So tonight, we've got the TrueNorth Health Center staff, or a good chunk of them, and we're calling it a night to meet the staff and ask the doctors of TrueNorth. So I grabbed this offline, I'm sure you'll be able to tell. TrueNorth Health Education and Fasting Center has operated its residential health education program in Northern California since 1984. Their programs educate participants on the benefits of healthy living and on the use of fasting as a tool to improve their diet and lifestyle. Like a compass, they help their participants chart the course towards optimum health. They call this direction True North. So tonight, and I will get out of the way here in a second, we've got Dr. Ellen Goldhammer, Dr. Michael Clapper, who's new to the area, but we've got someone in the audience who saw you speak 26 years ago. Wow. Pretty amazing, huh? Yeah. We've got Dr. Erwin Linsner and Dr. Timothy Grund. So you take that mic. Let me see how am I going to do. Let me actually shimmy past you.
You need to bring the table down, Stevie.
Okay. So we're going to go through some questions that people sent me online, and then we'll stop in time to take questions from the audience. Does that sound good? Okie doke. Let's try to be a little time mindful. I don't have my clock that I had last year for the panels. So Alan, let's start with you. Tell us about TrueNorth, a brief history, how it came to be, services provided, and what the philosophy is behind it.
So TrueNorth has been operating here in Sonoma County since 1984, so this is our 26th year in operation. This actually represents about half of our...
Someone can't hear, which is amazing.
Can't hear me?
Someone can't hear Dr. Goldhammer?
It's never really come up before. How's that? So we've been operating for 26 years. We've had the opportunity to help 7,000 people undergo supervised water fasting. We have about 10,000 patients that have been through our program through the various doctors. This is half of our professional staff. We do have some others who weren't able to be here tonight. And we represent an eclectic variety of doctors. We have 2 medical doctors, 4 chiropractors, we have a naturopathic physician, a clinical psychologist, as well as some support staff. And our approach is a little bit different, I think, than the traditional sense in that we believe that health is the result of healthful living. So our principal focus is helping our patients identify the things they can do something about in terms of diet, sleep, exercise, activity, etc., to give the body a chance to do what it does best, which is heal itself. We do use this tool of medically supervised fasting as a means of facilitating the body's ability to try to heal itself more quickly. And so we have patients that will come in with various conditions and fast for from 5 to 40 days on water only in a controlled, medically supervised setting, and then go through healthful diet, exercise, sleep, etc., both applied at the clinic as well as instructions that they can hopefully go home and follow through with. We also have a new service, which is the TrueNorth Health Kitchen, which is a food service business where our chef is able to prepare food for people in a cost-effective way, and they can either pick up or we can deliver the food to them so that they don't have to do as much shopping, especially as they're making a transition to healthful eating.
Well, and I do want to say I have several clients now using TrueNorth Kitchen, and they love it.
The food model that we use is organically grown fruits, vegetables, grains, legumes, nuts, and seeds. We do advocate a vegan program that also avoids the use of oil, salt, and sugar. And that's a fairly radical approach, because even though many of us involved in alternative integrative medicine don't really appreciate how important it is to remove oil, salt, and sugar from the diets of individuals if optimum health is really what the desired goal is.
So how did TrueNorth come to be? Why did you decide to create that?
When my wife, Dr. Morano, and I returned from training in Australia, we had worked with a gentleman named Alec Burton who specialized in fasting supervision at the Arcadia Health Center. We were impressed with the fact that sick people actually got well. And so we decided to begin implementing that type of approach here, and we did that again starting in 1984.
Okay, how about the rest of you? How long have you been at TrueNorth? What is your specialty, and what drew you there in the first place?
Hello everyone. I've been working with Dr. Goldhammer for about 16 years now. I met him when he did a lecture in LA. I had already been on a vegan diet for about a year at the time, and I heard him talk about fasting, and I said, wow.
I'm sorry, people can't hear you. Do you want to stand up, maybe?
Hello?
Is that too uncomfortable for you?
Can you hear me? Okay. And I was already in a vegan diet for about a year when I met Dr. Goldhammer at a lecture, and he was talking about water fasting. And I was a computer programmer and accountant at the time, and I decided, you know, that sounds really interesting, getting people well and taking drugs away or just removing the obstacles to health. So I decided to go to school, and I've been working with Dr. Goldhammer, and I'm a chiropractor, and that's how I got to working with him.
Hello. Everybody hear me? Yeah. It's new to me, a microphone. My name is Dr. Tim Grund. I'm Tim Grund. I'm a chiropractic neurologist, and who's newer? You or I, Dr. Clapper? You're the new guy. I'm a new guy too. I think I've been at TrueNorth now for 8 months, and I brought a large outpatient practice with me, and I've brought a balance, gait, and cognition program to TrueNorth. My specialty is the optimization of brain function. The reason I'm at TrueNorth is the distinct privilege of working with a team of doctors and a population of patients that are truly committed to getting better. And so I work with everyone from Olympic athletes, professional athletes, to children with autistic spectrum disorders, people that have had strokes, really anybody who wants to improve upon their brain function. So a lot of folks will come and stay for a month at TrueNorth and eat the wonderful food there or fast, and then take part in my program.
Hi, I'm Michael Clapper. I'm a Western trained physician. I graduated from the University of Illinois College of Medicine in Chicago. Took my medical internship at Vancouver General Hospital, and then did postgraduate training in surgery, anesthesiology, orthopedics, and obstetrics at the University of California in San Francisco. For most of my medical career, I've been doing blood and guts acute care medicine, but my real passion is keeping people out of hospitals and healthy enough to stay off of operating tables. And I've been vegan now for almost 30 years and see it as a very powerful healing modality. And so it's a delight to come to TrueNorth, where this is nutritional medicine done right. They not only feed people a very sound diet free of the salt, fat, and sugar that makes so many people sick and ill, but people, whether they're fasting or not, they are checked twice a day, vital signs are taken, and people are kept very close track of there, and laboratory tests are done. Everyone gets a medical exam by the MDs upon admission and upon discharge, and they're followed carefully as a program is tailored specifically for them. It's a joy to work with these people. The patients are all devoted to getting healthier, which is a great goal to start with. And my colleagues here, as an MD, I've had a congenital bias against chiropractors all my career, and working at TrueNorth has certainly stripped that away completely. These men are superb clinicians. Talking with Dr. Goldhammer is like talking to one of my professors of medicine at university. Dr. Linsner is a wizard at his physical manipulations. And to watch Dr. Tim Grund do a neurologic examination is to watch an artist at work. I thought I could do a good neurologic exam, but it's just superb and exciting to watch this man bring out the neurologic signs that he does and really help people get their brains functioning. So it's an exciting kind of medicine to practice where people get healthy, and all my clinician colleagues are dedicated to helping them get healthy instead of just putting pills down their gullets. And so I'm very happy I joined the staff, and look forward to being of service.
So I'd just like to point out that in the case of Dr. Clapper here, I told him 15 years ago that he'd be joining our staff. In a conversation we had, he laughed at me at the time, but now here he is. As Dr. Linsner mentioned, you know, we came across each other in a lecture format, and he told me at the time that, yeah, he thought that would be really fun, and he actually went to the same chiropractic college I did, except that he graduated valedictorian. And I've known Dr. Grund almost as long, actually. We met before you became a chiropractor. And actually, I think I was one of the people that was encouraging you to go to chiropractic college. And so we're very fortunate to have one of the few functional neurologists around on the staff. We also have on our staff Dr. Peter Sultana, who's a board-certified family physician, who's been with us since he trained with us after he did an internship with us as coming out of medical school, and joined us right away. And he's been with us for, I don't know, how many years now? 12 years. A long time. We also have Dr. Alec Isabeau, who's a fabulous chiropractor who does a lot of work with sports medicine.